Hello everyone, I hope you all are taking care of yourself and other in this hot summer. I am Dr. Puru Dhawan and today I will discuss water intake in kidney failure patients. So let's start with our topic. Have you ever heard of urinary tract infection? I have seen many patients dealing with the urinary tract infections. It seems like it's becoming a more and more common. In this case of UTI, what happens is that the bacteria from the skin or the rectum get into the urethra and cause an infection in the urinary tract. It is not a pleasant experience, but it's important to get it treated as soon as possible. And this happens when you drink less water or don't keep yourself clean and hygienic. But what happens in the case of kidney patient where they are advised to drink less water? Do they also suffer from the same? Yes, if a kidney patient or even healthy person don't drink enough water, their urine will be concentrated or yellowish and it can cause irritation and pain. So in this case, where kidney failure patient drinks less water, creatinine level will also increase. That's why it is essential to keep yourself hydrated. Let me tell you, water is pure. It doesn't contain any urea and creatinine, as well as it helps the kidney to remove waste from your blood in the form of urine. Therefore, it becomes essential to consume water on a daily basis. But in case of kidney failure, if you drink water in high quantity, you may experience swelling in different area of your body due to water retention, because our kidney are not functioning properly, which can cause problem like increasing blood pressure and can damage your lungs. During the summer season, it is really important to know how much water is best for people who have kidney failure. For this, firstly, we have to check whether there is a swelling in our body or not, especially in our legs. Simply press on your leg and see if you see any puffiness. It is possible you might have pitting or pedal edema. Similarly, if there is no symptom of pitting edema in your legs, so you can drink ample amount of water to keep yourself hydrated. Now the question arises, how much water intake we have to do? The answer is everyone should drink water according to their body capacity and needs. There are lots of symptoms by which we can get to know that our body is dehydrated, like dizziness or lightheadedness, headaches, tiredness, dry mouth, lips and eyes, passing small amount of urine infrequently. So we have to hydrate ourselves, but in the correct way. As I suggest, we have to drink half glass of water slowly with small breaks. If you want to keep your body well hydrated, it is best to avoid drinking too much water at once. Giving your body time to process the water will help prevent sudden going to the bathroom. Through this process of drinking water slowly, you can reduce increased creatinine level and your body will be hydrated as well. Another thing I would like to add here is, if a person is suffering from pitting edema, how they will keep themselves hydrated. So they have to consume less water with sip by sip method, because if you drink water directly, it can increase your swelling. Now I'm going to tell you how you can reduce excess water from your body. Try a low sodium diet. It will lower the swelling in your feet, and as you know, simple diet changes can make a big difference. There are some other way also, like stool, sweat and urine to release excess water from the body. We can take diuretic medicines like Lasix and Dietol that can be prescribed by a doctor. One important method that we can apply here is sweating. It is an excellent method of removing excess water from our body. If we release excess sweat, then it will be help in reducing water retention in our body. You can do yoga exercise or sit in a heat so that you can release sweat. But generally, it is advised to all the kidney failure patient not to perform heavy exercise, as it increases the muscle metabolism, leading to increased creatinine production in body. Now let's talk about heat. We can take a sauna bath to release excess sweat from our body. And if you don't have option for sauna bath, you can sit in a warm water, which will help you to prevent water retention in the body. But one thing you have to always keep in your mind, when we sit in hot water in summer, then the temperature of the whole body starts increasing, and when the blood gets hot, it can cause heat stroke. So you have to maintain the temperature of your head. But I suggest, if you are not professional, don't try this at home. By doing all this activity, fluid will reach to its normal level slowly, and it will also help you to maintain your protein levels too. Now coming to the questions of how much water intake is good for your health. If you don't have pitting edema, you don't have to worry about counting how many cups of water you drink each hour. But if you are suffering at the final stage of kidney failure, then you should pay attention to the removing water until you can get rid of swelling in your legs. And at last, I would like to say that if you have any doubts or query, comment below, or you can directly contact SRIAAS. I will see you in the next video. Till then, take care and stay healthy.